Hope Channel, changing lives.
Hello, good evening, and thank you so much for joining us on Hope TV, and the program is Love at Home. We appreciate the time you always share with us on Hope TV. On Tuesdays, I am always delighted because it gives me the opportunity to come into your homes so that we study and learn together. On Love at Home, our interest is to help bring families together, prepare ourselves as children, as wives, as women, being it health, being it raising children, parenting, what have you, or even love, what it is. Then we also try to prepare ourselves and meet Christ in his soon return. This is our core duty, and that is why Love at Home is here for you. In the month of October, we've been having a series of discussions on the breast. Yes, we've been talking about the breast. In the first week, we looked at breast care and significance. The second week, we looked at family and breastfeeding. And the last week was another wonderful episode where we looked at let her breast satisfy you. And today, we want to look at breast care or breast cancer patients, the support they get. Today's program is going to marvel you. You need to be by your set. You can join the discussion on Facebook and on YouTube, or send in your contributions or questions to 0559-680066. That's our WhatsApp line, 0559-680066. Angels of Hope, thank you so much for always sponsoring our shows on Hope TV. I am Efia Sewa. Let's go for a quick break, and when we come back, I will take time to introduce to you my guests for the day. We'll be right back. Please stay tuned. Thank you.
Anniversary, the president, the executives, Mid-North Ghana Conference, the pastor, elders, any asafoma, our Mount of Blessing Seventh-day Adventist Church, any infinisia ediasanu. Hooray! Jumadie etifia sem any infinisia ediasanu akwensi obi poneso. Yeah, ding, hini, na den. A journey of 35 years to the Mount, growing stronger, growing deeper, reaching higher. Jumadie ebakoso ewo Valley View University Auditorium, Techiman Campus, Ahini Mibosumeda etosu edionum watche, 28 October 2023. Anopano kono pepepe ne jumedie ashase. Jumedie yimu aforibo bekoso, botaya esi yeni so ne se, yedi isi asoridan amenyame. Etitria yato yensa afre omo, otitineni ene Owura Osei-Kwadwo, CEO Osei-Kwadwo Company Limited. Guest of honor, Nana Apentinfo Sujiabo II, Hensahini Onwasuneye Bemuhini of the Chiman Traditional Area. Guest speaker, Honorable Martin J. Mensah Kosa, Deputy Minister for Local Government and Rural Development, Onwasuneye MP, Techiman South Constituency. Special guest, Honorable Elizabeth Ofosu Ajare, MP, Techiman North Constituency. Honorable Emmanuel Kwadwo Ejekum, MP, Nkranza South Constituency. Honorable Benjamin Yaljako, MCE, Techiman. Asorin Penyifua, Jumedie si won naso, ene Pastor Jacob Ata Ankoma, Elder Thomas Kwabena Nkroma, Elder Osei Usukwesi, Elder Evans Ejapon, ene Elder Opon Fodjo Stephen. Enunti, yefa akwenye so aton safre, adofo, ebusuya, ankrankre, ene ejidifo se, yemfa yeni monyam embetai 35th anniversary yi echi. Nyame Israel se, wudi weni monyam ebetai jumedie echi. Mount of Blessing at 35, growing stronger, growing deeper, reaching higher. Mount of Blessing is Shirabepo.
Viewer, thank you so much for not leaving us and waiting on us. You are welcome back. You are watching Love at Home on Hope Channel Ghana. Yes, the program is Love at Home, and we are discussing the breast. We are discussing the breast. Please share, like, and subscribe on Facebook and on YouTube too, so that people can know or can listen to this all-important topic we are discussing for today. You can join calling the children, the family, the friends, because this topic is so critical and crucial to all of us, especially in the month of October, where in the world we are talking about breast cancer. I have wonderful guests and personalities on my show today, and I would want to take time to introduce them. On my far left, I have Miriam Abla Anani. She's a breast cancer survivor. Miriam.
Yeah.
Good evening.
Good evening.
How are you?
Fine, thank you.
Your pink is so nice.
Thank
this is
you.
hot pink. And you look good.
Thank you.
How was your day?
Very good.
And your hair and your wig too. Yes, it's nice.
Thank you.
I hear you're a fashion designer.
Yes, please.
So you sew?
Yes, please.
Oh, okay. And how is business now?
I would say it's normal since I'm on treatment, so it's normal.
It's normal.
Yeah.
But you're preparing for Christmas and the festivity
Yeah.
period. So you have orders coming, right?
Yes, please.
Ah, God bless your handiwork.
Thank you.
My other guest is Mr. Albert Asumeni. He's the CEO of Ellen Alote Memorial Breast Care Foundation. Mr. Asumeni, Akwaba.
Yeah.
How was your day?
Oh, by His grace, God has been good to us.
Okay.
It's been quite a busy day, but God has seen us through.
You encounter some traffic?
Coming. Normally, some few traffic on the motorway from Tema to Accra.
As
morning.
usual.
Yeah,
And the road
normal.
conditions too.
As for the motorway,
We thank God.
we'll leave that topic for
Yes,
another day.
yes. Yes, I also want to invite you, yes, my lovely viewer and listener, you out there to this all-important show. We are discussing support for breast cancer patients. Now, my dear Miriam,
Yeah.
who are you?
Okay. I'm Miriam Abla Anani. I'm a fashion designer and a breast cancer survivor for 3 years now.
So what do you mean if you say you're a breast cancer survivor for 3 years now? So you are even putting years by them now?
Yeah. 2020, I was diagnosed with breast cancer, but this thing started in 2018.
2018?
Yes, please.
How old are you, if I may ask?
I'm 32 now.
32 now?
Yeah.
It means you started at the age of 29. All right.
Yeah. So I saw a lump in my breast. That was 2018. I confided with my mom and she said it's normal, but I just have to use pomade and it will go.
What type of pomade was she talking about?
The shea butter.
Nkuto?
Yeah.
The shea butter? Okay. So you were applying it on the breast?
Yeah.
Which part of the breast?
The left.
The left one?
Yeah. So I did it for 6 months and the thing started growing. The lump became 2. And I told her, she said, oh, it will go away. You know our mothers already. So I just had to, I had a boyfriend by that time, so I confided with the boyfriend and said, okay, the sister had a lump in the breast and they removed it. So we should go and ask the sister about it to know where we have to go and all those things. We spoke to the sister. But this guy was saying we should go to these herbal medicines. We did the herbal for like a year. And when we go to these herbal medicines, people, they will just tell you it's something spiritual. Something is following me from my mother's side, my father's side, all those things. So I just didn't want to believe them. Since I'm a strong Christian too, I didn't believe them.
To God be the glory.
Yeah. I always pray before I go anywhere. So anytime they are saying things, I know they are just lying. They just want to take the money.
Okay.
But one of the herbalists gave me medicines and it was working. The lump started to shrink. I called this man back. He was just telling me, it was in Cape Coast. He is in Cape Coast. He said I should pick car to Cape Coast now. And when I went there, I was with my boyfriend. He said I should come alone. I could see he had bad intentions for me, so I didn't go. I stopped the medicines, and the medicines changed color too and all those things, so I have to stop. I later had an auntie who told me a friend of hers is suffering from breast cancer, but her own is rotten and all those things, but she's taking this herbal medicine, but she's fine. but I should go and speak to the woman so that I know the food to eat and all those things. I spoke to the woman. She showed me this herbal medicine mantle. I got that this mantle was saying someone is following me from the mother side, the father side. I don't know which side they are following me from. But this mantle gave me medicine. That was in the lockdown period. And the medicine changed color again.
The medicine changed color or the breast changed color?
The medicine changed color. The breast was so big now.
Wow.
With balls on it, 3 balls on it.
Wow.
But the balls will like go away when I started taking the medicine. So I could see the medicine was working. Called this man, I told him the medicine has changed color, changed scent. Said, oh yeah, I told you someone is following, someone has spoiled the medicine for you. And I said, no one comes to my shop. The medicine is in my shop. I don't put it in the room. I was not working by then. It was lockdown. So who has changed the medicine? Is it my boyfriend or me? So in 3 days' time, I had a news like the woman who showed me the place died.
Oh.
Confide in someone now to know what to do, because I don't want to die like this woman too. I could see there was something I have to do about it. I spoke to one of my aunties, and she was saying, oh, Abla, I thought this breast is normal, because I normally see you with these singlet tops and all. I said, just look at the breast. One is bigger than the other. Said, oh, people have breasts like that. But so I hold the one that was not affected. And she could see that there was something in the breast. He said, ah, and you are sitting with it. You didn't tell anyone. Didn't you tell your mom? I said, ah, these old ladies, they would tell you there's nothing wrong with you. And your dad too. He said he's praying. So we are still praying. Maybe it will go away. My auntie said, okay, we are in the lockdown period. She doesn't know what to do, but she will call the other relatives to tell them what exactly is wrong with me. If my mom is not like doing anything, maybe my mom doesn't have money. I could see she doesn't have money. That's why she's doing that. In the afternoon, she called me back. Because the lady who even introduced me to the herbal medicine was a friend to my auntie. That's why I confided with my auntie to tell her about what has gone wrong. Okay. In the afternoon, she called me back. She said, okay, have you eaten? I said, no. Because all my money is finished.
It's finished.
She gave me foodstuffs and all those things. And she said, my uncle said they should give me 1,000 cedis. And to go to the hospital, not to the herbal medicine, but go to the hospital. Which hospital do I want to go? I said, oh, I have the card of police hospital. So I will have to go there to see what they would tell me. I went to the hospital the next day. Because she was saying, if I don't go, she's going to call my uncle to collect the money from me again. And I was also afraid. Yeah. So I went. Got to the hospital, saw the doctor over there. The doctor even just looked at me with all my nose masks, with my boyfriend's nose mask, said, I know you. Tell me, I don't know you. But in a year time, before that time, I went to the hospital to do my cleanup checkups about myself. And I met the doctor. And I showed him the breast. And he told me to do biopsy. And I ran away. That same
doctor?
Yes. And I ran away. So in a year time, I got back. He said, I know you. I said, I don't know. He said, why are you lying? Just wait. I'll have to talk to you. He spoke to me, saw the breast, said, why have you sat for so long? How many years now? I said, for like 2 years. So why are you doing this to yourself? I said, it's not my fault. I don't have money for this treatment and all this. He said, but you paid for the herbal medicine. I said, yes, I paid. Said, okay. He had to do the biopsy. Do I want to do it? I said, yes. Do I have money? I said, oh, my auntie said she would pay, so I have all the money. They did the first biopsy. It came back. There was nothing in the breast. It was just the mass. There's nothing inside. He said, no. This thing is, because there was balls on the breast too. He said, this thing is like cancer. I just don't want to say it's
straight away.
But just let me do the second biopsy. So we did 2 biopsies. Before it came back, it was cancer. That day when they were telling me, all they were telling me was just passing through my ear to the other ear, because I don't want to listen to anything. I just asked him, will I be fine? He said, yes. But I have to refer you back to Korle Bu, because your case is very different. And the medicine over there, he doesn't want me to get stranded. He just had to take me to Korle Bu. I said, okay. If only I will go. I said, I have to go, because this thing is worrying me too. So went back to Korle Bu. I did my first cycle. The doctors over there spoke to me like I have to lose my hair, my fingernails will become dark, my palm will become dark.
So
and
they told you what you will see,
yeah,
the changes you are going to see on your body.
And this vomiting and diarrhea and all those things. I said, am I going to be fine? Because I'm not bothered with all those things. I know my system and I know what to eat too. because they showed me what to eat and all those things.
Okay, so you are going to share what you eat and what you don't eat and all that with us later on. Let me come to Albert. Albert, who are you?
By His grace, we are good.
I hear you are the CEO for Alote Memorial Breast Cancer Breast Care Foundation.
Yeah.
Why that?
Okay, thank you. And good evening to your cherished viewers and listeners. Ellen Alote Memorial Breast Care Foundation came as a result of my wife contracting breast cancer, and unfortunately we lost her to it. So family and friends, we came together. Before that, when my wife was diagnosed, and my wife was a healthcare personnel, so yeah.
Healthcare. So healthcare people today can get it.
Breast cancer is no respecter of persons or profession. She was a midwife. So when she was diagnosed and she started her treatment, I discussed with her and I said, no, now you know what you have gone through. I just pray to God that you survive it. So that we set up a foundation to use you as a testimony to save others. So it's something I discussed with her in the course of her treatment.
All right. Was your wife old?
No.
Roughly how old was she?
My wife, she was diagnosed at the age of 33, 34.
And she passed on?
At the age of 36.
Within 2 years interval?
Yeah.
Okay. She was a health practitioner.
Yeah.
She didn't see any sign, you didn't see any sign coming, like Ablan was saying she saw changes and all that.
Okay, so her condition started when she was pregnant.
She was pregnant?
Yeah, that was her third pregnancy.
Okay.
Yeah, at the age of 2019. She's the type that whenever she's pregnant, she's very strong. She goes about her work and all. She doesn't take leave anytime she's pregnant. She works throughout till when she's due. She takes her annual leave and maternity leave together. First one, no problem. Second one, no problem. So the third one, she wasn't quite well in the course of the pregnancy. But all of us thought pregnancy and its issues. So it was one of those things. But I got to a point she was complaining of back pain, the spinal cord. Sometimes she's not able to sleep well, and the breast started becoming heavy. Yeah, so you know when you're pregnant and the hormonal changes and the breast cells, so they keep growing like that. So in fact, she thought it was that. And she went to the hospital. In fact, before she was diagnosed finally at Korle Bu, she was there more than 4 times. Yeah, sometimes at a point they even said it was pneumonia because of the back pain she was experiencing. Yeah, until one of her doctors, she complained to the doctor, she checked the breast and said she can feel something inside. So we should go and do ultrascan. Yeah, so I remember I went with her, we did the scan, and we took it to the doctor, and the doctor referred us to one doctor at Korle Bu that we should go and see the doctor. So he took the thing, checked the thing, and said we should do mammogram. After, the long and short is that she had to go and take a biopsy, and it came back positive to breast cancer. Yeah, so she was around 7 months into the pregnancy.
Almost due.
Yeah, almost due. So I remember very well, it was around June 2019. Yeah. So, in fact, it was a tough time when the news was brought to us. So we had to just take it easy. And she's someone she was in high spirits, and I had to also support her. And you know, in this situation, you don't have to lose hope.
Yeah, very
Yeah,
true.
you don't have to lose hope.
Very true.
So from day one, we were 100% hopeful
Yeah.
that she will survive it.
Yeah.
In fact, that is what prompted me to even bring up the foundation to her, and she accepted it. So the back and forth in Kolebu and all that. Fortunately, on 10th of August 2019, she delivered a baby girl.
Wow.
Yes. The doctors wanted to do CS, wanted to do forced labor, but she was able to push naturally, and she gave birth to
strong woman,
a very nice girl, Ohima. So when we named her, then I told my wife that. Then we named my daughter after my grandmother. She's Amasewa.
Okay.
So I told her that the foundation will be Amasewa Foundation.
Okay.
So that we'll use our daughter as a testimony for the foundation.
Yeah.
Yes. But throughout the treatment, 2019, 2020, throughout the lockdown, she was doing well, she was doing fine.
And she was breastfeeding with the other one?
No. When she delivered on 10th of August, the breast one was the one that was affected. So the doctors, the left one. So the doctors asked her to use the right one to breastfeed her until the 3rd of September.
Okay.
That was like 3 weeks interval. From 10th August she delivered to 3rd of September. It was a Friday. That was the day she started her first chemotherapy. So from there till today, my daughter never tasted breast milk.
Oh.
So she was just breastfed for 3 weeks.
3 weeks.
Yeah. The rest was just baby formula.
Okay.
And we started her with, after 6 months, started with introducing Ghanaian food to her.
So how many children do you have now?
3.
3. Yes. And Ohima is the last
Ohima
one.
Is the last
so
one.
The first one is how many?
Berima is 7.
Yes.
Obapa is 5. Ohima is 4.
So now you are the woman and then the man.
Yes.
Doing everything.
The one in all.
God bless you.
Amen.
God bless you.
Amen.
Now, Miriam.
Yeah.
Generally, I was asking you and you said something that sometimes our family people do not understand this breast cancer thing. For example, that is how come your mother told you to use shea butter.
Yes.
Your mama catch yourself and kuto fire horn because that is the perception.
Yeah.
Do you think it is still the same or it has changed?
It's not the same because just like could see last week or so, she was just crying and praying, and I asked her what's wrong with her. She said, I don't want you to die, and I don't want the way you are feeling the pains and going through these things. I don't want that. She's 71 now.
Okay.
And when I saw her that, I just told her, don't cry because of me, please.
Okay.
Leave me alone.
Okay.
Let me enjoy my life.
Okay.
Me, I'm enjoying my life.
Okay. Okay.
Because I want her to be strong for me.
Okay.
But she's old.
Okay. Now, what are some of the symptoms? What did you see or what are you seeing that makes you feel that there's actually something wrong with the breast? Or what did you see for you to be convinced that there was something wrong with the breast?
We normally know, like, this women, when we are done with our menses, we have to do this breast check
Yeah.
to check our breast and all. So I was just doing it and I could see the lump. There was something inside the breast and it was very painful. Some people, when they would just tell you it wasn't painful, but mine was very painful.
Okay.
Yeah.
Okay. It was painful.
Very painful.
So that is where you got to know that there was something actually wrong with the breast.
And it was changing color too.
Okay.
My color was like a chocolate color, but this breast was becoming dark. One is dark and one is chocolate color.
Was it at the nipple, the
No, the whole breast.
The whole breast?
Yeah.
Okay.
With pimples or like balls on it.
Balls on them. Okay, so so now you are going through session. You are not done with the curing.
I was done 2 years ago.
Okay.
And I had a reoccurrence this year.
This year?
Yes, please.
Okay.
At where they did the surgery. So it's at the chest side.
Okay.
Because when I was finished with my treatment, the doctor told me my own was attached to the chest wall. I have to do urgent radiation.
Okay.
But you know our system these days. Our machine over there, the machine is only 2. So it always breaks down. So they waited 6 months before they called me to do my radiation.
You were in queue?
Yes.
Okay.
So I had to wait for 6 months. And that 6 months, when they called me to come, I didn't have money.
Okay.
But I went with faith. Because I told them, I don't have. Because they were putting me on the new machine. I told them, I can't pay. Because even if someone wants to support, you can't let the person pay like 100 and like this 120 million for you. So they should put me on the old machine. They put me on the old machine too. I couldn't pay. I started my treatment, paid like it was 25 cycles.
25 cycles.
Yeah, 25 days. You have to go there 25 days. Monday to Friday. Saturday and Sunday you rest. Then you start again Monday to Friday. And all these sessions that I was going, there was no money. At times I have to work. So when I get there, these survivors over there too will support me with transportation or something to buy food or something. I paid, the first week I paid 400 cedis. And they were saying like my treatment was 5,200. 400 cedis out of 5,200. And I learned I have to pay 2,000 before they start the treatment.
Yeah, as deposit.
Yes. But the doctor saw that and I told them, I don't have. And I've already started. So do you want me to stop? You can't let me to stop too. I finished with my treatment, the 25 cycles. I paid only 800 cedis out of 5,200.
Okay.
And the doctor asked me, Miriam, you know I'll be in trouble when I go and put your folder down. And I said, I know you'll be in trouble, but Miriam, I don't have.
Okay, now Miriam, looking at where it started, yours took more than 2 years.
Yeah.
And you were still going up and down, visiting herbal people,
yeah,
traveling here and there. I remember you were sharing a story with me that one of them told you to go to the cemetery.
Yes.
To go and pluck some particular leaves and apply.
Yes.
That one too didn't work.
Yeah. It's what a champ or something.
Okay. And it was only at the cemetery that you could find that type of leaf, and still it didn't work.
It didn't
so
work.
You had the opportunity. You were going up and down, going to prayer camps. You even went to prayer camps from the story you said. So why do you think yours was able to take that lengthy time? Because in Albert's case, we didn't get that.
Yeah.
Yeah. Why do you think yours was a bit?
Dr. Yeboah, when he saw me that day and he diagnosed me of the cancer, he just told me God was on my side.
Ah, okay.
And God is backing me because he knew some people's cases like 6 months, a year, and they die. So why did God have to let me wait for 2 years before they would do the treatment? And the treatment too, wasn't easy. The chemo, I had to do 8 cycles, went for review, and they said I have to do extra 2 because the lamp was still attached to the chest wall. It wasn't moving. For them to do the surgery. Okay. So I do 10 cycles of chemo with this small body. And that chemo too, it's costing a lot. And that after the 8th chemo, they told me to do echo before I can do the second.
They told you to do what?
Echo.
What is echo?
It's checking for the heart, whether the heart is so strong.
Echo, okay.
Yeah. Okay. They checked and they said the heart was so strong, I can take the extra 2. I did the extra 2. Finished, they called me for surgery. I told them I don't have money because the money is finished. The aunties that was backing me stopped on the first chemo. So ask me how did I did all the 10 chemo?
Yeah, you'll get there. You'll get there. Now let me come to you, Albert. You as a husband, when the news was given to you that your wife was going through this, how did you manage it?
As I said, when she wasn't feeling well, we didn't know that was the case. So I was with her. In fact, from day one, from the first ultrasound to her last treatment she took, I was with her throughout. So, and it was a surprise to us because at a point, all of us thought it was a pregnancy-related issue. So when the doctor said after the mammogram that he said we should take the biopsy, it was taken to a lab around Kolebu. I've forgotten the name.
Pathology Without Borders.
Yes, good. That was where it was taken to. So when the results was ready and we were called, she told me that the following day they said she should come. So in the morning I went with her and it was given to her. And that the news was, in fact, they had to speak to us because her condition and all that. In fact, all the doctors became interested in her case because it was something like a test case for them. A pregnant woman who has contracted that, looking at her period, she was almost due. And she had friends, as I said, she was
a health worker too.
Yeah, so she had friends also around. So most of the doctors knew her. So they had to counsel us before they broke the news to us. At the point, it wasn't easy, but we had to come back and face the reality and say that no, we will fight it. But the only thing is that for us, we decided that we want to keep it to ourselves. We didn't want a lot of people to know, because the reason being that, as they say, people cry even more than the bereaved.
The bereaved.
Yeah, it's not. At that point, you need positive energy.
Exactly. For you,
So you don't want to be discouraged.
Yeah.
So in fact, my wife's parents got to know her situation. In fact, that was the very year she passed on, to the 2021.
Okay.
We had to tell her siblings.
Okay.
My in-laws, the brothers-in-law, my sister-in-laws, they knew it.
Yeah.
So they were supporting, giving her all the encouragement, were helping everything. But we needed to just keep it from, because the mom, we knew that she couldn't handle the situation. Exactly. Until I said, said all the time we need that encouragement, you know. It wasn't easy, but the thing was we had to face the reality.
Okay, so when you had to face the reality, now you've seen that you are the mom, you are the father at the same time.
Yeah.
How is it for you now?
Oh, for now, I would say God is my strength.
Amen.
Because it's not easy going through everything. Sometimes I still ask God questions. Initially, it wasn't easy. I tell friends that when I lost my wife for like 2 weeks, I felt now God has disappointed me.
Yeah.
Yeah, because why? You said we should leave everything to you handle for us. We had hopes, trust everything in you. And it happened. But let me share this with you.
Do.
2 weeks before my wife passed on, sorry, I was coming from, I live in Tema.
Okay.
I left Kolibu around 10 p.m. I was going back home, and I was involved in a deadly accident on the motorway. That was 9th of October 2021.
God saved you.
It was a Friday night, yes. And my car was damaged beyond repairs. I was the only one in the car. In fact, when the police got to the scene and saw the car, the commander told one of the guys that you should call fire service to bring something for them to cut and take the bodies out. But I survived that accident. No cuts, no broken bone,
God be the
nothing.
Glory.
So one of my elders, I always say that Elder Wallace, he's at Community 12 SDA Church. He's the one that encouraged me. When the whole thing happened and my wife died, he asked me, Albert, how many God do we have? I said, oh, Elder, we have one. He says, no. So the God that saved you from that accident and the God that made your wife die, who do you think is a good God? And I said, oh, I sat for some time and I realized that no, I'm just being human.
Yes.
But God is God, irrespective of your situation.
You can never understand him.
Exactly.
Can never understand
He knows what will happen tomorrow, and he knows how he will handle you.
Yes,
so I just have to come back to myself and say that no, whatever that has happened, I just have to pray to God to give me the strength to carry on. I don't know where I'll also live, I'll exit this world. But whatever strength God will give me, I have to also support these children. So now, I just have to sit them down and tell them that, look, mom has gone to heaven. She's not coming back again. Whatever you need from mommy, tell me, I'll do it for you. But I made it clear to them that mommy is not coming back again. And I saw smiles on their faces because heaven came inside. They heard heaven. And they knew heaven is a good place. Yeah. So if mom is there, they are sorted. And that is what we have lived with till today. And I'm the mom and the dad. And I have to say that I have to also appreciate and say a very big thank you to my wife's family, they've been very supportive from day one that she was diagnosed. Apart from the moment that we decided to keep the information from them, the sisters and the brothers were all the time with us. She was admitted. Sometimes we go on admission, she will be discharged, chemo. Sometimes when after the chemo, you feel nauseous. Yeah. She can't eat, nothing. In fact, I had to, when she was diagnosed, I had to research on cancer. Now it's like breast cancer has become, I don't know if I have to even go and study formally on it, because it has become one of the area that interests me so much. So anything around it, I want to know. So I read a lot about it, the treatments, the effects, the food you have to eat, some medications when you are buying, you have to check for her and all those things. So I was preparing her food, her diet, everything. I was, all right. It was something that was heartbreaking, but afterwards, God is still keeping us.
God will still keep us.
Yeah.
Miriam, God will still keep us.
Yes.
Albert, God is still there.
Yes. We have trust.
My lovely viewer, our Savior is still there. Yeah. Let's pause here. Let's go for a quick break, and we'll continue with our discussions. Please remember to invite your friends, share, subscribe, like, comment, send in your questions if you do to 0559 680066. We'll be right back. Please stay tuned. Thank you.
Hi. Do you know that alcohol is the most abused drug on earth? Do you also know that smoking a cigarette may take 11 minutes of your lifespan? Do you have someone who is psychologically derailed or mentally ill? Do you know that 1 out of 4 women is abused daily? Do you know that now it's common for children under 12 years to smoke and drink? Do you know someone who is addicted and is struggling to overcome addiction? Then there's a good news. The Wounds of the Heart is bringing you qualified practitioners, personnel who understand certain situations. We meet them in their offices, at their homes, at their comfort zone, and right here on our studios. Make a date with me this and every Wednesday at 4 p.m. right here on Hope Channel.
Every individual has a story. Stories of social issues such as infertility.
You did not marry your wife only because she's going to give you a child. You married because you loved her. Whatever comes on your plate, you're ready to accept that.
Abuse, obesity, life struggles, and others can be very frustrating. That is why Real Talk is back again with another exciting season where individuals like you can come into our studio or join us virtually to share your story and experience. To share your story, you can reach us through our WhatsApp number at 0559 680 066, or you can email us at hoptvghana@gmail.com. We say don't lock them away. If you ignore them, they can just get angrier and louder.
Hello, my lovely viewer. You are welcome back, and you are watching Love at Home, and we are discussing support for breast cancer patients in the Breast Month awareness. Remember, in the month of October is the Breast Month Care, and so we've been discussing the breast, and that is why today I have Miriam and I have Albert, and we are discussing this all important topic. It is important that you invite and share and call in your family to come and listen, learn and unlearn. I always say learn and unlearn, so that we will keep the spirit high all the time. Now, Miriam.
Yeah.
What are some of the treatments for breast cancer patients? Since you have gone through for a while and it went, but you are still fighting it.
Yes,
it has come back and you're fighting.
Yeah.
What are some of the treatments you have gone through so far?
The first is chemo, after chemo surgery.
Okay, so let's start with the biopsy.
Yeah.
What is the biopsy?
They will take a small specimen from the breast and take it to the labs, that is Pathology Without Borders, and they will give you, like, you go for your report before you take to the doctors, before they will know the treatment they have to give you.
Okay, so it is there that they will know what kind of treatment. So in your case, what treatment was given to you?
First chemo and surgery and radiation.
So you have done surgery?
Yes, please.
And you have done radiation too?
Yes, please.
Okay. In all this, what was the expectation of all these?
The doctors will tell you, you just have to stick to what they tell you to do, and take your medications and sleep. When you're feeling sleepy, just rest. Don't stress the body. So I was just doing that. But you know me, the fashion designer, I can't go without stressing the body. I'm already stressed already.
So you were still working alongside?
Yeah.
Because you had to look for money, I guess. So you had to work so that you'll be able to take care of those bills they were paying. Now, you've already talked about the support that you were getting. At a point, your auntie who was supporting you, I guess it was too much for her.
Yeah.
So she left.
She didn't leave, but she told me it was the lockdown period and she was not working too.
Okay.
So she was just doing her best.
Okay.
So I understood her.
Okay.
And I have done my first chemo. I have to do the second chemo. It was like 3 days to my chemo. I didn't have money. But I was having this white man friend who I met him on this array, just passing by, and he just saw me and said he liked my skin color, he wants to be my friend. So I told this white man, he went back to the States because of the lockdown. And I told him, and he was just saying, oh, Miriam, I don't have money these days, but I just told him, I didn't want your money. I just want someone to talk to. Because my boyfriend was just behaving some way like I was worrying him too.
And you didn't have anybody to talk to?
Yeah. Because my parents were saying there's nothing wrong with me. I just want to take the chemo, and the chemo is like a poison to me.
Okay.
So I didn't want to talk to them about my situation. It was just my boyfriend and this white man friend that I had. So I told him, and he said he will do something about it. But he will give me the second cycle of chemo money, and the third cycle he's going to give me half. And every month I'm going for my chemo, he will pay half, and I'll work for the half.
Okay.
Yeah.
Which he did?
He did everything.
Oh, God bless him.
Till the 10th chemo, he did everything.
Okay.
So when I was done with my chemo, on the 8th cycle of chemo, my boyfriend told me he was tired.
Okay, so this chemo thing you're talking about is supposed to do away with the lump?
Yeah.
So that you'll be completely healed?
No, it will shrink the lump and they will do the surgery.
Okay, so that they'll be able to take out whatever the residue is there left.
They are not going to take out, they will take all the breast.
Okay.
Some people's own is like the lumpectomy. That is when they will cut some portion of the portion of the breast and take it out. But mine was all the lump was covered with all the breast, so they have to take it off.
Okay. Take the lump off or take the breast off?
Take the breast off. That is the mastectomy.
Okay, all right. But I see your hands are black.
Yeah.
Why?
Because of the reoccurrence this year.
Okay.
So I'm taking another chemo again and another drug, that is the Zeloda.
Okay.
Yeah.
All right. So far, how is it?
I'm okay. The first treatment, when I started, you know, this body, our system is not used to these medicines and all those things. I was becoming weak, throwing up, like it's like normal chemo, just throwing up, diarrhea and all those things. But after the 3rd week, I went to the hospital, complained about it. They just gave me medicines, like injected to my chemo to make me feel calmed.
Okay, all right. So now your family has come to terms with what you are going through. Do they understand exactly what is happening to you now?
I'll say my mom and my dad understand, but my brothers, they are just saying, I just want to take.
Still?
Yeah.
They are still saying that?
Yeah. I even showed my chest to my brother. He was just saying, you are just worrying yourself.
Okay. Now, let's talk about the issue of stigmatization. Your neighborhood, I mean, where you live, are some of the people aware that you've gone through this exercise?
I was in my shop, one of the ladies came to sew their dresses. And I normally wear this singlet tops. I was not wearing I was not wearing my bra and everything because I was alone in the shop. The woman entered and she said she wants to sew something. After she said, Abla, me no, for me na jielu.
And I will not for a year now.
And I said, oh yeah, I thought you knew.
Why, your breast has it been removed? That is what the lady asked you. Okay.
And I said, I thought you knew. He said, oh yeah, but I thought they just removed the lump. I said, oh no, they couldn't remove it, but they just have to remove the breast. She came back again and she asked me, if I talk to you or hand over money to you, will I get affected also?
The woman asked you that?
Yeah.
Okay.
I was so surprised and I told her, oh no.
Okay.
You are not going to get infected. The thing is inside me. He said, oh, okay. But she doesn't know about it. I said, oh, yeah, I know. So I gave her some of our flyers about how to examine our breast. And she said, oh, okay, she thanks me, man. She's now fine with me. Okay. When I'm going through something and I'm working on it, she will just go, are you okay? I said, oh, yeah, I'm okay.
Okay. Okay.
I could see she didn't know about the breast cancer, so I just have to educate her.
Yeah. And she was okay. What about what about the rest?
I was in the market, and that was last year. I was buying my braziers, and this brazier woman knows about my situation, so she gives me braziers, what to wear and all those things. So I was giving her the pink ribbon. And one of the ladies asked, why am I giving it to her? She said, oh, I'm a survivor, but she just liked my vim, how I go about talking to people and how I go about these radio stations and
educating people.
Yeah. She said, breast cancer. She started looking at my breast like this. And I said, why are you looking at it? She said,
has your breast been cut off?
Yes, and I said, yes. She started looking at the breast again. I said, oh, please, I'm wearing something inside, so you don't see anything.
Okay.
And she said, oh, okay, will she get infected when she... I said, oh, no.
Okay.
But she should go get screened.
Okay.
That was the October month last year. And she said, oh, okay. And she, from now, when I'm passing by, she says to me, oh, are you okay? I've gone to... will you go for screening this year? And I said, oh, yeah, there will be screening this year too. Okay. So anytime they see the screening around the area, she should go.
She should go. All right. So in your own little way, you are educating people, and you are not ashamed, you are not scared. And what do you see the impact? Is it impactful?
Yeah, it's very impactful, but some people also say, like, would they get it? Is it contagious? So I normally put it on my status, like, it's not contagious.
I think I saw it on your status this week.
Because a friend of mine came to visit me and she asked me, I could see they spoke about me. She came to ask me, if I hug you, will I get some? If I talk to you, will I get some? If I eat with you? I said, no. So how is it? I said, the thing is inside me.
Okay.
And she said, I could see they spoke about me, but she didn't know how to explain it to me. And I said, is there any problem? She said, no.
Okay.
The stigma is in the church now. I would say it's in the church.
In the house of God?
Yes.
Oh.
I don't want to talk about it, but this one day I have to talk about it. The stigma is too much.
Okay.
Because how is someone going through this thing and you are like, you don't want to come and visit the person, as if when you come close to her, you get infected also. I don't know why.
It's lack of education.
Yes.
Don't to know.
So last time I posted on myself, lack of knowledge, my people perish. Because you are not, if you are reading the Bible, you have to know things about inside the Bible. You may be a man of God, but it's not everything you know in the Bible too.
Okay.
You have to be educated also.
Okay.
I don't know why they are doing that.
Well, I guess people are watching you.
Yeah.
And it is another form of education we are giving here. So whoever will hear you also get to know that this is the time they need to reach out to you. And that is why we are doing this discussion. We want people to know the kind of support that you need if somebody is going through this situation. Now, Albert, I'm still coming back to the support.
Yeah.
What are some of the supports really that patients of breast cancer or cancers in general will need to help them or uplift them?
Okay. Coming to the support, aside the financials, you see the treatment of breast cancer is very expensive. Very expensive. And with the chemo she's talking about, Kulebu is cash and carry.
Cash and carry?
Yeah.
It's not on card.
You pay before. Sometimes as soon as you finish, somebody is sitting there, you pay the money there.
Roughly how much?
In fact, at the point we were paying 7,000 cedis for one cycle.
One cycle.
Just one. If I say one, like
mean
one
visits
one
for a day?
injection at the radiotherapy. The medicine is called Herceptin.
Accepting.
7,000 Ghana cedis for one. And you take it every 3 weeks. Every 3 weeks, you pay 7,000. So in a year, you take like 18 cycles. Multiply
times
18
7.
by 7,000. It's over
If inflation
100
has not affected the price.
This 7,000 was ASAT 2021 that I'm talking about.
Okay.
And my wife took it for 2 years, every 3 weeks. So multiply 7,000 by 18 a year times 2. Aside the financial, that one is there. But you see, you can have all the money, but as Miriam is saying, if the person is not emotionally strong, the medication will not even work.
Yeah. Okay.
You need to encourage them, give them all the support. In fact, I had to fight one doctor at Kolebu emergency. My wife was in critical condition, so we had to rush her there on a Sunday. Unfortunately, chemo, Kolebu, the surgical, where they look at them, and the radiotherapy, they don't work on weekends.
Yeah.
So when we went there, we had to be redirected to the polyclinic for them to refer us back
Okay,
to Kolebu.
yeah.
So she was taken to emergency. Fortunately, I had one of the doctors.
Contact number.
Yes, Dr. Issa, wherever he is, God bless him so much. And Dr. Issa was on duty, so he asked us to put her somewhere, take a scan, so that the following day he will come and assist. So whatever procedure they had to do, one doctor came that he wanted to do it. At that time, I had gone out to get some medication for her. And the doctor came. In fact, the way he spoke to my wife, I got in there, she was crying. I said, why? What happened? I said, Albert, I wish you were here some few minutes ago. And the doctor had come to insult me and a lot of what. I was there and the doctor walked in again, coming to her and said, what's wrong here? Yeah, dear mama, I will not bet you. So I called and said, Master, come. Don't go to her again. I said, who are you? I said, I'm the husband. You are not a professional doctor. Whatever medication you are administering, without good emotional support, it wouldn't work. Maybe you have to go back. In fact, I was so furious. And I'm saying this for other medical personnel who are taking care of these patients to know that that person could be your relative.
Yeah.
So whenever they come to you, treat them with all the love and care. Because the support that family need to give them is not money alone. Encouragement.
Yeah.
Give them love. Let them smile. I mean, you just have to lift their spirit up for them to sometimes forget about whatever they are going through. And that is the biggest support that I would advise anybody to give. Just understand the situation. And it's not something that they went out to contract. It's not out of any bad thing they have done.
Yeah.
It comes naturally. So when it comes and you are fortunate to know whatever the person is going through, be there for the person. Let the person know that you care for the person. And the financial support, if you can, give. Because when you have cancer, there's no time to waste.
Yeah.
If you wait for a day, your life is reducing because the treatment you need to get, if you are not getting it, the cells are growing every day. They are growing every day. And the chemo and those things are supposed to just slow the growth down and shrink the lump.
Or whatever.
Yes, so that they can work on it if they have to do surgery. In my wife's case like this, unfortunately, we were not able to do surgery because at the point we had the stage that it got to, it had moved from the breast to other parts of the body.
Other organs were affected.
Yes, it first moved to the bone.
The bone.
Yes. So the bone marrow was affected.
It was fast.
Yeah. That's what I'm saying. If you delay, I'm sure the time she was pregnant that all of us were thinking that her condition, the pains and everything she was going through was
as a result of the pregnancy. It was something else.
It was something else.
Okay.
Because at that time, the body is going through a lot. So the cells, this is when you are pregnant, the cells grow very, very fast.
And abnormally increased.
And the cancerous cells is the fastest one among them.
Okay.
So if you are not able to get the diagnosis to know that this is wrong with you, so this is the treatment plan you have to be given. You just be there and you go like that.
Now, Miriam, how can we prevent? What type of foods, in your case, what have you been told to be eating? How is your food plan? How can someone prevent this?
They will tell you to eat a lot of fruits and vegetables.
Okay.
And this starchy food is not good for us.
Okay. So starchy foods like what? Mention some of the food.
There's banku and kenke.
Banku and kenke, they are not good for you.
Yeah, but if you want to eat, you have to eat a lot of vegetables.
Okay.
Like when you are preparing your banku, add a lot of vegetables to it.
Okay.
To eat.
Okay.
The greens must be enough in our food. And this blend, this carrots and all those things just to drink.
Okay. It supports the cells.
The cells.
Okay. All right. Now, what should we be eating? In your case, you said you were preparing your wife's meal.
Yeah.
How?
So as Miriam is saying, the preventive thing is that generally you have to stay healthy.
Yeah. Okay.
And everything that she's mentioning is the healthy foods. You need to eat more of vegetables and reduce your carbohydrates.
Yeah.
So if you eat banku, one ball, you can reduce it to half and eat more of vegetables.
What about exercise?
Exercise is good. Yeah. You have to, like anything that will help your general well-being, yes, you have to do it. Because as I said, the cancer is not something you can pinpoint that this is the cause of it.
So as at now, you've not been told what brought it?
No.
You still do not know?
No.
Miriam, what about you? Do know?
No.
Nobody has informed you that, oh, you did that?
No.
So, and you do not have any history in your family to say that somebody in your family had it?
No.
So probably it is in your gene?
No.
What about you?
So let me say this. Family is the majority. Research has shown that over 80% of breast cancer patients have no family history.
They are first-timers?
First-timers. The majority of them. So family history, yes. If somebody has breast cancer in your family or has had breast cancer previously, then yours risk become like a higher risk.
Higher risk, yeah.
Yes, so you have to be checking.
Yeah.
But majority of them have no family history.
Okay.
So you can get it without any other person getting in your family.
Okay.
And you can also have family history and not getting it.
Okay.
So it's like that. So all the time, all you have to look for, especially women. Today I was on one program. I was saying that breast cancer is not contracted in October. Don't wait till 2024 October again before you go and do breast screening.
It should be everyday talk.
There's a woman watching us that when you even give her a mirror and show her breast in her for her to see in a mirror, she cannot identify her own breast because you don't pay attention to
ourselves.
Know your breast all the time. After your menses, 4-5 days after, try and massage it and see. There are some people that have lumpy breast. Naturally, there are lumps in their breast. It's not cancerous. So if you know that from day one, there's this lump here, I've gone to check. It's not cancerous. When you check and it's there, you'll not be alarmed.
Yeah.
But if you don't know, it may not be cancerous. But because you don't know, one day you sit down for 5 years, go and do. They thought there's a lump in your breast and you get scared that, hey, is it cancerous?
Yeah.
Because when we started doing our screening, we had about 4 ladies who had lumps in their breast. One, they had to take her to General Hospital to check.
Okay,
after
so you'll
we
be
did
using
everything.
this to wind up and to advise us, but when you, I don't want you to say it in a local dialect tree so that people can also appreciate it in just a minute.
Okay. Into the Mecca after breast cancer and one say we made the bear futu at the mobile or especially a ma because the ma we are at higher risk pa the first one they say Nyankopon ball or bar. O your bar or risk no higher. And so your bank one there I saw who say you stand at a risk of getting breast cancer. Me matiminya and so endorse. Inti all the time no, ma wani emra unufu no ho. Men train say October say breast cancer awareness month. Wako hospital bi akoye, obesa aye bi ma. I just say next year October. Every month, untimi anye kran every month. It's say one kasa. Utimi hu say dia unufu ni tie. So that changes bipa quickly because the real thing na research actually say omo a omanya breast cancer omatimi survive a omanwu no eye omo a yehu no at the early stage 1.
Okay.
Move from stage 1, stage 2, stage 3 dia. I just say nyame bem. Nti wan kasa ma onufu ne ehu hia. Wo your bear man so a me I have experienced it. Menya miri ne nyae. But all the effects and everything I have
exactly. Living 3 children in your care.
Into your bema, na so you didn't pay attention. You have to.
Thank you. Yeah. Thank you so much, Albert. Now, Miriam, what do you have to tell my lovely viewers and listeners? Your last words, but say it in any local dialect for them to appreciate.
My last words, I just want to thank some people for the support and the care and the love. One is Georgina Jaga, is a survivor. She's my champion because she made me to do my surgery. And she's like a sister to me now. She's always encouraging us. She has a group that is Sisters for Sisters. Yeah, and secondly, I would say Sonotech, Dr. Grace, I just want to thank her for my labs and all the support she's been giving me. And also Safe Haven. They give us these braziers for us. We have our special brazier.
Special brazier.
Yeah. They give it to us free of charge. I want to thank them, Auntie Janet and her crew and all the supporters over there. I want to thank them. And also Mod Local Foundation. And also Sisters for Sisters and Nick. Nick, my white man friend, I want to thank him also because this year's chemo, he paid for the first cycle.
God bless him.
And he's been encouraging me in all those things, talking to me not to give up and all those things. I want to thank him also. And lastly, my friends and family and I would say
everyone.
The doctors and nurses who are supporting also.
So what should your last word, what advice do you have for them? People watching you, those who are having it and those who do not have, but say it in Ga so that people can understand you. Just in a minute.
In everything we have to give thanks. I always say this to myself. It's just by grace that I'm still alive. So
Right. It says, do not be afraid. God is with you. We've heard a lot. We thought that breast cancers were for the elite or breast cancers were for the aged. Today, you are hearing it here that as at age 27, 25, people are getting breast cancers and people are dying. At the same time, people are being survived. So if the fact that somebody died doesn't mean you will die. You may be able to survive it. So please, go, check, let them do the screen for you. If there is nothing there, to God be the glory. If there is something, immediately they'll be able to take care. And to our family members, please support us. Support everyone who comes to you and is in need of breast cancer so that they can live and live well. On this note, let me thank Miriam. God bless you.
God bless you too.
May you live long.
Amen.
I pray that your next chemos and treatment, everything will be fine.
Amen.
And you'll be healed.
Amen.
And be healed in the name of Jesus.
Amen.
And to you, my brother Albert, a strong man, God bless you.
Bless you.
May He give you enough to take care of these children.
Amen.
And be great and greater and greater. And may the foundation also go well.
Amen.
To you, my lovely viewer, thank you so much for joining us on the show. It's been a wonderful discussion. I have learned a lot. From here, I'm going to check. Why don't you follow me? Same time next week, we come again into your homes. Thank you and good night. Bye-bye.